Hi, I'm Rowan, and this is my reflective journal entry on multiples. And I'm mostly going to be talking about twins because um, that's all that I do have experience with. I'm following the framework provided in the assignment. Here's my notes. Um, so, first, through the autobiographical lens, what can I currently bring to the space of a multiples birth? Firstly, including experience, because I was lucky enough to attend three different twin moms in my first 2 years of school. Um, and, well, technically four, but the three, I really was with them all throughout pregnancy. Two, I attended at home successfully, and then the third ended up transporting out of our care at the onset of labor. She was in dates, but once she started experiencing early labor, she also started having symptoms of preeclampsia. So um, that was a really interesting experience because we sent her into the hospital 2 times that they ended up sending her home, which was really surprising to us. And we actually had to advocate a little bit more for like more interventions and to like facilitate delivery. Um, and then that mom did end up getting transported to the neighboring island to the higher risk hospital, um, where they were able to provide her with the medication that she needed, the Magsulf, and um, have a vaginal delivery that was really swift and uncomplicated. So that was great. And then, so yeah, I've associated I've witnessed and had experience with some of the associated complications with multiple gestation, such as preeclampsia, liver problem, or kidney problems, um, and whatnot. So, um, ba 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 ba. I do feel like, I mean, I have so much to learn still, but I do feel like I got some good experience with kind of recognizing like the variations away from normal that might occur for a twin gestation, um, prenatally and intrapartum and postpartum. So yeah, and just kind of having a little bit of experience with like putting the whole picture together uniquely for when it comes to twins and not just a single gestation. Um, Number two, through the student's eyes, thoughts, considerations, comfort level regarding multiples. So a big consideration for me here that I'm gonna have in practice is the rural practice that we have here on this island. Um, the importance of concurrent care is gonna be like a must in practice because I really learned through my experience how important it is to have those ultrasounds, those regular labs, and to be on working concurrently with the facility that would be the receiving facility in the case of a transport or um, case of a transport either before term or after term, whatever the case may be. Um, Understanding really clearly like the role of chorionicity in terms of deciding what the care plan is. An informed consent document that is very specific to a planned twin birth. I have that for like all variations of normal, including like a planned breech. So yeah, it's just a different set of informed consent information and shared decision making than just a standard singleton gestation. So yeah, and then the birth team, being really clear with the patient about the fact that we will need a really like a much larger and comprehensively skilled birth team. So far, I've attended twins with 3 experienced midwives and 2 students. So 5 of us total on the team, and I really feel like every single one of us had, a very important and holistic role to play and we were all extremely busy. No one is like sitting on their hands at a twin birth, even with 5 of us. So it's really important. Um, yeah, so considerations, the birther's personal, ethical, and spiritual needs in the process, of course, as much as I'm willing to work with that, within my scope of being licensed. And then what I've learned from my preceptor, which I consider really valuable information, even though it might not necessarily be translated into evidence-based literature or whatnot. And part of that is like she's been in practice for 40 years. She's had a wonderful reputation with outcomes. And she's really passionate about like the birther's approach and mentality and attitude around having a twin vaginal birth at home, their ability to make sound, informed decisions, be open to needing to utilize higher levels of care at the, whenever we recommend, like, okay, it's time, and just their ability to really, like, collaborate on the same team in those ways is really important to her. So, yeah. My colleagues' experience, community standards, legal ramifications. We are illegal as far as our scope of practice right now, basically, because you can be licensed, but the actual law for licensure hasn't been written yet. It was about to, but it's being protested right now. There's actually a lawsuit against the state for making licensure mandatory, which is holding up the process of the actual licensure scope being written still. So we can, if there's an adverse outcome, someone, of course, can, like, sue, like a patient can sue. I've seen that happen still. But I will say, personally, I haven't seen that really turn into actual much legal ramifications for the midwife because we don't have those laws yet. So, yeah, but having someone designated that's really, really good at charting, I've seen is really important. The theoretical literature aspect, I've seen very mixed information depending on all the different studies that I look through, and I feel like this is common when we're trying to interpret and gather data on high-risk births or variations of normal, because so much of the outcomes in the data are contingent on the environment and the physicians that are present and their skill level as well. So, like, this study was performed in, like, North Africa. Their results showed that a higher rate of early neonatal death in both vaginally delivered twin 1, 9.4%, and twin 2, 11.9%, than those delivered by cesarean section, 3.8 and 3.5% respectively. So, in that environment, in their particular study, it was definitely showing that there was a higher risk involved with the planned vaginal deliveries as opposed to the cesarean sections of the twins. But then I also found a document, Labor and Delivery of Twin Pregnancies. This is Obstetrics and Gynecological Clinical Maternal and Fetal Medicine Associates, Department of Obstetrics and Gynecology, Medicine at Mount Sinai. So their team had this really comprehensive study as well. I'll cite all of these in my assignment, but they said patients with twin pregnancies greater than 32 weeks with the first twin in vertex presentation should be counseled that planned vaginal delivery is not associated with adverse maternal or neonatal outcomes compared with planned cesarean delivery. They also go in to address, like, the combination of vaginal and cesarean delivery, where, like, maybe the first one is born vaginally and the second one is born by cesarean. So they speak about that in here too. But a lot of the literature that I've found has kind of come down to similar conclusions of the importance of chorionicity, the risk factors involved, like uterine atony, postpartum hemorrhage, those types of things. So if we can be prepared and well trained on those things, plus prepared and well trained for non-vertex presentation of twins, which is more common, I do think that that could influence better outcomes in a care environment. So yeah, I'm going over time. Sorry. Thanks for listening.